1 in 8 people live in mental health condition. This is the statistics given by WHO, World Health Organization, that 1 in 8 people live in mental health condition. And the same message I want to share with all of you. So it's a request that you remember, that you act on the message, and that you share the message that there is no health without mental health. There is no health without mental health. It's that simple. This is the definition of mental health. I want to break it down for you, which is given by World Health Organization. Mental health is a state of mental health well-being that enables people to cope with their stresses of life, to realize their abilities, to learn well and work well, and contribute to their community. Mental health is a state of mental well-being. So well-being doesn't just mean absence of illness, okay? So a state of mental well-being that enables people to deal effectively with the stresses of life. In the lives that we are living, uncertainty is going to be there, no matter how good you are at manipulating stuffs or in controlling people or situations, or no matter how certainty or predictions you would like to make. Uncertainties and stresses and disappointments and negative experiences are a part of our reality. So it's just inevitable, right? But dealing effectively with stresses of life has to do with your right mental health, I mean your good well-being. Second, to realize their abilities or potentials. It's very important for an individual to come in terms with his or her own talents, skills, creativity, intelligence, potentials, and abilities, and to act on those potentials and abilities. One can make others happy only if one is happy with oneself. Many of my talks sounds philosophical, but these are the basic truths and realities of life. So before you ignore or jump to conclusion, this is what it is. And this doesn't mean that you being narcissistic or arrogant, or you just thinking about what makes you alone happy, and so you be happy at the cost of making others suffer. That's not the thing, okay? So this line of discrimination is very, very important. But for you to realize and act on your own abilities and potentials is very important. So I give you a simple example. If a student in the class knows uh, the answer of the question, the answer to the question, and is willing to participate, is willing to volunteer, but is not giving the answer, is not participating, this is a concern with regards to his or her mental health, with his ability, with his potential. The student is not answering because the child doesn't feel enough confident in himself or herself. Maybe the student is afraid of how he or she will be judged by the teacher or by his fellow mates. Maybe the child thinks that what if I'm laughed at, or people just make joke of whatever ideas, opinion, or answer I share. Or maybe what if what I answer is completely wrong and I don't want to feel humiliated or embarrassed, or I don't want to be wrong. So this is not a well-being, this is not a proper or appropriate or optimal state of mental health. This is a concern. Third point, learn well and live well, and work well. This is so, amazing. If you have the right knowledge, the right education, which is realistic, not just right and wrong according to you or the society, but basically if you just learn well, you update yourself with the right knowledge, with the right education, and most importantly, and then you work well. So this has to do with your workplace relationship, a relationship with your boss, with your supervisors, with your colleagues, most importantly, with everyone, not just with your friends, but everyone involved at the workplace. And workplace is again one of the biggest stresses of our lives, and some people at the workplace really makes it difficult for you. Like, I know because I myself have experience, I have heard others experience, so I can completely relate to this. And this also happens because the people who are making other people's lives terrible, they are just not ready to help themselves, and so it is really really difficult to be around them and to work with them. But in general, if as an individual responsibility I'm focusing on, that you share good relationship with everyone, and wherever you are finding problem, like I said no, about those people who makes other people's life terrible, um, see what help we can give them, and if they are open to receive the help basically. But yeah, they are the ones who make it difficult, I understand. And individual contributing in the community. So being a responsible citizen and sharing all our potentials and talents, how skillfully one is contributing and is an important part of the society. So all of these factors in this definition is referring to a state of a well-being, a good mental health. Second thing is, what happens if mental illness goes untreated? If and when mental illnesses or poor mental health condition goes undiagnosed and untreated, there are a lot of destructive consequences for the one who is suffering, as well as for the people who are around this individual, and as a whole the society, the community. Okay. So I'll give you three simple examples to understand this situation. First example is of a student. The for a student, his developmental years plus schooling years is very very important. Like, no one can give you back your childhood time. You just have to now make sense of it somehow, so that you don't suffer in case if any trauma or any difficulty was there. But right now I'm just talking about one a specific problem. So let's say if this student has a learning difficulty, reading, writing, arithmetic comprehension. So let's say if the child has a poor IQ, intelligence quotient is poor, meaning the child might have some intellectual difficulty. Or let's say this child has specific learning difficulty, specific learning disability, or some neurological problem, for example ADHD, which is a neurological condition. Any of these cases, if the child's academic years are getting disturbed, I would say getting wasted, and the institution as well as the parent, especially the parent, who are not taking care or are not accepting his or her difficulty, then one can imagine how many years, how many developmental years or educative years of the child, of that student, is getting wasted. And at one point of time, let's say this learning disability or difficulty was not, learning difficulty, it's no longer disability. So learning difficulty was not addressed in those primary section of his years, and now suddenly the child is in 7th and 8th class, and like has difficulty in writing even a short paragraph or essay of his own, and it's not able to do the math and science, basically is not able to meet the demands of the curriculum. Plus child growing physically, emotionally, so social development is also involved, and the student is still having the difficulty in reading, writing, arithmetic and comprehension because the problem has gone untreated, firstly undiagnosed and therefore untreated. And even if it was addressed, parents has not taken any action. So can you imagine the damage done and the consequences of this? Second thing, let's say if a student or adolescent or any of us are actually having issues with our self esteem, okay, with our personality, with our emotions, and if we are not seeking any help, then at any sensitive point one might commit suicide also. And in the past few months, a student of class 8 and 9 jumped off the terrace only because uh, he was the parents said no to go for a party or something. And there are many more same or similar types of uh, incidences like this. But why to wait for a student to suffer? Why to wait for a suicide to happen only for that family member, for that individual, for that parent, for that couple, or anyone of us to realize about the problem or the difficulty? What is the point of you having the intelligence? What is the point of you having education if you are just not understanding even the simple thing like this? You are just living an ignorant life. I may sound little harsh here, but this is real ignorance. This is real sin. SIN. Like this is real ignorance. Third example, let's say of a couple who chooses anger and resentment over love, who chooses blame and complaining over getting treated about whatever issues and problems they have. Both of them, couple means two people, right? So both of them at a couple level as well as at an individual level. Can you imagine the life of the children of this couple who suffers so much just because someone is not in good terms with their in-laws, someone is basically not in good terms with themselves and with even the people at the workplace or anyone? How much terrible life they are living, and most importantly how much terrible lives they are making of others just because they don't want to correct themselves. They lack not just the understanding of mental health but also the humility and the compassion, which are so basic to our human values and has to do with our existence. So this couple who chooses anger and resentment over love, imagine the life of their child, their children, how much they suffer. I mean, what is their fault? This couple needs to work up, no? That's one thing. Now you must be aware of someone who has a problem with alcohol. So this individual consumes alcohol every day, and you just have to talk to their family members and you will understand what is the level of their suffering. Like what is the level of suffering of someone who is living with an alcoholic person? So much of disturbance and to some extent trauma, which is not same for everyone, or some lot of other difficulties are also involved. But same is the case with person who is in mental health condition. Now mental health condition is anything and everything. It's just not referring to mental health disorders. So I'm not at all talking about the disorder, let's say clinical depression, or someone is having OCD, obsessive compulsive disorder, or has a PTSD or a panic disorder, or has to do with other mood disorders like bipolar disorder. I'm not talking about the real condition which falls in the category of mental disorders. I mean, these are mental disorders which needs different type of diagnosis, assessment and treatments. I'm also, so this is definitely one thing, but I'm right now referring to mental health conditions like mentally, emotionally, behaviorally, and also the condition which I said in the first example, learning difficulties, which has to do with the IQs or specific learning disabilities, or emotionally, like about the couple thing. But when, as and when this mental health conditions goes untreated, it creates lot of problem, it creates many destructive behaviors, and suicide is the common example. 1 in 8 people live in mental health condition, 1 in 8 people. And you can check uh, the report which I will be sharing in the next session. So wait, but what it says that suicidal rates are so higher, and I'll just talk about India and the metropolitan cities here to give you the statistics of it. Second thing is that people with living in mental health condition faces lot of problems, human right violations, discrimination and stigma. Again, it is coming from lack of acceptance about mental health and lack of proper or accurate understanding. ऐसा है. Now, human right violations or discrimination, like right to be accepted, right to be respected, right to be involved in family decisions, important decisions, and right to be involved in the community. These are basic human rights. You are important because you exist. What you do with your existence is your personal problem, your personal choice. But each one of us are valuable and important because we exist. And so comes the human values here, like how you are treating another person. And it's not like you can help and treat everyone, but you can be kind and respectful to everyone, or at least to the people who you are in contact with. And then and where you are finding some difficulty, so you know the treatments I'm talking about, that's what is one thing to be done. I mean, the life is given to you in this human body is not for enjoyment, is not to gratify your senses. It also has to do with your existence, as in how meaningful you are making it. For this the life is given, how meaningful you are making the self with the capital S, and how quickly you are overcoming the self with the small s. So as it is explained in Bhagavad Gita, ego is important, ego, but there is this false ego and the true ego. So Bhagavad Gita emphasizes on developing the true ego, which has to do with your divine capabilities and potentialities. In short, you can refer to all right now to human values and love and friendship. And many of my talks may sound a bit philosophical at times, but these are the truths and these are the realities. The more you are in the right wisdom, in the right knowledge, the less you suffer, and that's how you alleviate the suffering of people around you. Okay, coming to the discrimination part. So you see, prejudice is a negative attitude. We may have a prejudice about, meaning holding negative attitudes about certain objects or events or any stimulus. And when that prejudice, meaning negative attitude, is shown in a behavior, is called discrimination. So people living in mental health condition, um, they also face this discrimination, the negative behavior towards them, and so which increases the stigma, uh, the resistance to seek help. Although there is a lot of good mental health care facilities, but the gap in needing the care and access to the care or the treatment is the real concern. All of this is at a reasonable low cost, but still there is a huge discrepancy between needing a care which has to do with you realizing that the care is needed and then accessing the care, the treatment. Now, how you can seek or take help of a mental health professional? First step is, of course, you accepting and realizing that you need a help. Asking for help is the bravest thing one can do. Just ask for help. And of course, it matters where and to whom you ask. But it's okay even if some mistakes have been made, and it's okay if in the past you had not so good experience. But now, with the right knowledge and understanding, first you come in good terms with yourself and allow yourself to take help. Ask for help. Remember, asking for help is the bravest thing one can do. Ask for help, and you can take help by seeking the shelter of Lord Shri Krishna. You may take help of someone whom you have considered your guru, your role model, your inspiration. You may take help of someone whom you trust. And through the help of them, you may also take help of a professional. But asking for help, considering the option of help, is the bravest thing you can do. So please ask for help. And coming to seeking a help of a psychologist, so first you become aware of the problem, and even just getting ready. You can check on Google the psychologist near you. Now, how a psychologist will help you? First, you have to take appointment with the concerned one. Very basic thing. You will have an interview or a session with the psychologist, with this mental health professional, and together we will assess the nature of the problem or the symptom or the condition. And depending on the nature of the problem or a symptom, right guidance or treatment will be given to you, which involves few other things. But the problem will be discussed with you, and like I said, depending on the nature of your problem or the symptom and the condition, right treatment package will be selected. And this all goes very objective. So just to give you an example, let's say someone is actually in difficulty difficult in emotions wise. Okay, so let's say someone is having difficulty in doing daily things, has sleep problem, appetite changes, and having frequent thoughts of committing suicide, and is very feeling low emotionally. Okay, in other words, let's say there is some indication of this individual suffering depression. Let's say this individual consults appointment with a psychologist. So now they both are together, sitting in a comfortable setup, and of course everything is kept confidential. So they are sitting in this setup, comfortable setup, and the client, the individual, is sharing the problems, and the psychologist is understanding every single thing about this person, which is at a very objective level. And depending on the nature of the problem and the symptom, like I said, maybe it's a depression, so it needs to be assessed, it needs to be checked. So the psychologist will take a series of assessment just to check out what is the intensity or level of the problem or the symptom. Okay, and then the psychologist doesn't give medicine, so we give counseling. Like I am a psychologist and a psychotherapist. Psychotherapist mean I am trained and licensed in a particular type of therapy, which is a cognitive therapy, and I follow a holistic approach meaning depending on the problem, I am offering this psychotherapy to my clients. So I and my client will then work together to help him or her, or to help this individual overcome the condition, the problem, the symptoms of depression. And the sessions will be conducted every week over a period of few weeks or months. And this is how the individual will be able to understand his mental condition, and most wonderful thing will be, out of the condition the person will overcome his problem, his depression and his mental health condition, plus will be equipped to how to handle it. Okay, so you have to basically check on the Google the city you belong to, about a psychologist, the mental health professional. You have to take the appointment, and this is how the treatment will be there. And rest is something which, as you take the step, you will understand it, but this is the basic way in which one can consider help. Okay, sought help. So remember this message, please share this message. There is no health without mental health. Thank you so much.